Anaesthesia of the teat in cattle. For the indications, this is done when there's a local teat lesion in the field, and teat anaesthesia is done in the standing position to avoid other trauma. For extensive teat lesions, you can do a nerve block at the proximal or distal paralumbar, or an extensive teat or other surgery in the clinic under general anaesthesia. In theory, you would do L2 and L3 when doing a block for anaesthesia, but in practical terms, it's not good enough. For preparation, you have a standing restraint and you give xylazine, ketamine, and butorphanol, and it has to be done IV while standing. Make sure there's a tail tie and a hind limb restraint, and prepare the area by clipping, scrubbing, and giving alcohol. A ring block of the teat can be done, or an inverted V block over the surgical area can be done, or a teat cistern infusion can be done, as well as a vascular local infusion. For a ring block of the teat, you need 5 injections around the base of the teat, and you insert a needle of 22G to 24G, and you inject 4 milliliters of 2% lidocaine, so 20 milliliters in total, and you wait 5 to 10 minutes for proper anesthesia. In the case of an inverted V block over the surgical area, this is for a localized lesion in the case of a laceration. You do multiple injections with a few milliliters under the skin and the muscle layer, and you wait 5 to 10 minutes. And in the case of a teat cistern infusion, this is when there's a mucous membrane abnormality in the case of polyps, but there's an intact mucosa. You place a rubber tube or a tourniquet over the base of the teat. And make sure you remove any remaining milk, and then you insert a sterile teat tube or a cannula, and then you inject 10 milliliters of 2% lidocaine, and you wait 5 to 10 minutes for proper anesthesia, and you do the surgery. And make sure to milk out any remaining lidocaine and remove the tourniquet. And for the vascular local infusion, place a rubber tube and visualize the venous plexus, and then inject 3 to 5 milliliters of 2% lidocaine into the plexus, and then wait about 5 minutes for proper anesthesia. Then do the surgery and then remove the rubber.